afternoon, everyone, and welcome to A Gathering Place, brought to you by the Gullah Geechee Chamber of Commerce. And today's theme is public health awareness, where we sit down with St. James Health and Wellness and find out what's going on with public health. You know, our monthly themes, what's going on with the Affordable Care Act, because we really care about folks uh, getting their insurance and other information that St. James Health and Wellness brings us about your personal health and public health and the services that they provide. And I can't wait to hear from Linda Lina, representing St. James Health and Wellness. And we're going to meet Linda right after this.
Hello, I'm Marilyn Hemingway, and welcome to A Gathering Place. I said, I'm stepping back because we have young voices who want to be heard and they're moving on something.
Branding is really important to you and your business.
Even a basic type of technology, you'll learn it all.
And people are
Good question.
Well, welcome back. And I want to remind everybody, we're not only on Facebook and YouTube, but we're on Twitter also live. And of course, a number of Facebook pages and groups. So if you go to our YouTube channel, please make sure you subscribe and like us on Facebook and on Twitter. Follow us because we've got a lot of information to share across the Gullah Geechee corridor through the Gullah Geechee Chamber of Commerce. And of course, we can't wait. Let me go ahead and bring in Miss Linda Lina with St. James Health and Wellness. Hey, Linda, how are you?
I'm blessed. How are you all?
Doing great. Thank you very much. I am going to go ahead and pull in the slide
Okay.
so we can share that with folks, and we'll get going as you speak. You got some Affordable Care Act updates for us.
That's correct.
Very good. So whenever you're ready, I'm ready for those updates.
Okay. Basically, what is new is what is called ICRA. And basically, that's like assistance for individuals who have business and want to be involved in the SHOP health insurance marketplace. Then you have an expansion of your income range for up to 1,100%, which means that your special enrollment for anyone from 100 to 150% of the federal poverty level. So if your income falls within that category, then you can go into the marketplace now up until December 31st and enroll into a plan.
All
So
right.
that's
Very
pretty
good.
exciting.
Yes.
Okay.
And that means individual coverage health reimbursement arrangement. Why now? What's going on?
Exactly. Okay. So basically, how ICRA works is based on reimbursing employees for insurance rather than buying it for them at a high level. Employers designate or design their plan, including defining which employees are eligible and establishing reimbursement limits. Employees purchase the individual plans they want. Employees submit claims for reimbursement, and employers reimburse employees for valid claims. So it makes it a lot more or less tedious, and it should flow much more smoother. The process for setting up an ICRA is step 1, which is pick a start date. Step 2, design classes for eligible employees. Step 3, determine a budget and set allowances. Step 4, establish legal plan documents. Step 5, communicate your new benefits to employees. And step 6, provide resources for employees to purchase individual health insurance. And that's one of the things, as a navigator, I can assist an employee as well as an employer with.
All right. Well, that sounds interesting, that process. What when we say step 2, design classes for eligible employees, what type of classes will the employees be taking?
Basically, they would be taking classes to understand the different insurance coverage that are available and what they need to do to be enrolled and to stay enrolled.
Very
And so
good.
basically, that's what that is all about, as well as, the employer knowing about it as well. Now,
Very,
with the special enrollment period, as I mentioned, it started in March of this year and it will end as of December of this year. And the good news is that now employers offering an ICRA or what is called a QSEHRA will trigger special enrollment period for employees, giving them 60 days to buy a plan. This is key so employees can purchase qualifying plans and allow your employers to set up an ICRA year round. So that is also a good thing for people to be able to have.
sounds
And
like it builds in flexibility.
exactly, exactly.
Very
Which,
good. And
yes.
qualifications.
To qualify for an ACA plan, anyone has to be between the ages of 18 and 64 can purchase a plan. Who qualifies for a subsidy? Those are household incomes between 100% to 111% of the FPL, which is the federally poverty level, and you're not able to get affordable coverage through an employer, theirs or their spouse's plan, not eligible for other coverage such as Medicaid, Medicare, vets coverage, etc., or if married and file a joint tax return.
All
So
right. And income range. So
exactly.
on the left hand side, I see there's family size, and
Exactly.
then you have the income levels. And can you explain this for our listeners?
Basically, what it's saying to you that if you're a family of one, then you would fall within the 100%, which means that your income yearly would run about 13,590. And then as you notice, the percentage goes up. And if you fall within that percentage based on your family size, you are eligible to go into the marketplace and to register for a health insurance marketplace plan. And it goes down to a family size of 8, and the maximum for that is 500%, which is 233,150 dollars.
All right. Very good. And of course, we know, folks, that if you have any questions about this, you can contact Linda Line at St. James Health and Wellness. And this chart shows the increase, I believe,
Yes.
under the new
Yes.
process.
Yes, as you can see, previously it was from 100% to 400%. Now it is now 100% to 1100%, which makes it better because it allows more individuals to be able to go into the marketplace and file for coverage. And as it indicates here, it says that the Affordable Care Act, SEP, is from 100% to 150% of the federal poverty level.
Okay. Did I go backwards?
I believe so. And if you have any questions, you feel free to give me a call. And my name is Linda Lina. I am a navigator through the health insurance marketplace. And whatever services I provide, it is free at no cost. And you can reach me at 843-826-3773.
That's 843-826-3773. Miss Linda Line at St. James Health and Wellness. Linda, it's always good to have you on
Thank
to keep
you.
us updated with what's going on with the Affordable Care Act. So thank you very much. And I'm coming. Hold on, let me get back to you here.
Okay.
All right, there we go. And everyone, I'm going to have that scrolling at the bottom of the screen. But we got some other stuff coming up too, Linda.
Yes, we do. Every year during the month of August, particularly the first week in August, we have what is called National Community Health Center Week. which all federally qualified community health centers throughout this United States celebrates. And each day we have a different event. We recognize churches. We also recognize what we call stakeholders, who are your political individuals that serve our area. And also we do patient appreciation. We do staff appreciation. And those are some of the things that we do. Now, for our finale, we're going to do a back to school event, and that's going to be on the 13th of August. I'm trying to rush things here.
So don't
And,
rush it.
and it's going to be held at the Winyah Bay Auditorium, and it's going to be on their lawn in Georgetown. And the time for it is going to be from 10 to 2 p.m. So we are really excited, and we have some various vendors that will be available to provide services. And some of the vendors that will be at the event is going to be Live Well, Tidelands Health. We have yoga, and also some other items that will be available at that time for you to come out and to enjoy. And we will also have refreshments as well and giveaways. So,
All right, very good. Go ahead.
I was just going to say, if you have any questions about that, then you can feel free to give me a call, and I can let you know who you would need to talk with in order to be able to find out more about the event itself.
Very good. Glad to hear that, Linda. And I think this flyer, because I received it just a minute ago, you also have it in Espanol, Spanish also,
Sí,
for
sí.
For our Hispanic
Yes.
Spanish speaking neighbors. So very good. We welcome everyone to this event, because
Exactly.
diversity, healthcare, it all impacts everyone. So
Exactly.
it's good to see that St. James Health and Wellness is taking care of our neighbors, also all of our neighbors. So this month is, this is June, but the month coming up in just a couple of days is July.
That's correct.
And the month of July, I did a little research, and the month of July is UV safety month, and UV is ultraviolet light, folks, the sun. So we wanted to bring that to everyone's attention, and I was trying to get to the website so we could look at some information. And the website was not it was the I guess the website for ophthalmologists. All right, and they were talking, because ophthalmologists are concerned about ultraviolet lights because it impacts our eyes.
Exactly.
And people don't realize that, especially during the summer, and we're bouncing that sunlight is bouncing into our eyes. But could not get any information from the website specifically about that. But also, I'm gonna pull up a page that has a listing of what's going on in July.
Okay.
And I was actually really interested in what's going on. And didn't realize what people do recognize in July. Let me go ahead and bring that up.
And the other thing, Marilyn, with the ultraviolet light, you have to be careful with your skin, because if you get too much, it could possibly cause you to have skin cancer.
That's right. And when I thought about it, when I saw it, I really thought about skin cancer first.
Right.
When I saw that the ophthalmologists are also pushing UV safety in the month of July, because smack dab in the middle of summer, and the beginning of summer actually, but it's the heat of the day and that sun just beaming on us. And you are correct, Linda. It's not only our eyes but our skin also.
Exactly.
Too much exposure can lead to skin cancer.
Exactly.
So they have in July Cord Blood Awareness Month, and you can find out more at parentsguidecordblood.org. The International Group B Strep Awareness Month, and that is at I went too far up. Hold on. GroupBStrepInternational.org. Then Juvenile Arthritis Awareness Month, another one. I've actually heard of juvenile arthritis, and I'm sure Linda has also. And
Right.
you can Google juvenile arthritis and get more information about that so we can start taking care of our children.
Exactly.
National Cleft and Craniofacial Awareness and Prevention Month. And you see folks with the cleft in their face. But you know, the wonderful thing about the folks with cleft, they can have access to surgical repairs if they
Right.
so desire to repair their cleft. And of course, UV Safety Month, National Youth Sports Week. So we're outside a lot during the summer with our outdoor activities. National Youth Sports Week. And one of the things before you send your kids out doing the sports and all, make sure you go to St. James Health and Wellness and get a sports physical.
Exactly.
And then World Hepatitis Day. We must be aware. Go to website worldhepatitisday.info and get more information about that. But we wanted to bring to your attention the July Health Awareness Month themes, and we'll talk more in July about August because we want to get ahead of it. And if you need to go to the doctor and get some treatment information or just a primary care visit, you can call Linda Lina at 843-826-3773, and she will help you not only get Affordable Care Act insurance, but she'll help you get educated about the services provided by St. James Health and Wellness. Linda, anything else today for us to know about?
Just basically, I want to remind everyone that COVID is still there. We need to take necessary precautions, and they are now talking about the possibility of another variant. So we need to make sure that we keep up with what's going on. And also, in order for us to continue to get the services that we need to make sure we get out and vote.
That's right. You know, Linda, I'm glad you mentioned COVID because I was just reading yesterday, South Carolina, I believe 10,000 new COVID cases and exposures and 5 deaths. COVID has not gone anywhere.
Nope.
As much as we would like to, go about our daily lives, we still need to practice caution. We still need to wear the mask. I have my mask here, and I admit I don't wear it like I used to, but especially when I'm around people,
Right.
put this mask on. Outside, I tend not to wear it because I'm not around. It's open. Honestly, I try not to be around people.
Right. I understand. A lot of
Tight
people
places
feel that
and
way.
stuff. Yeah. And I still practice social distancing, washing my hands. So there are things that have just become good habits that we could yes, Angela Davis Britton. Thank you, Angela. Is there an address or email to Miss Lina? Linda, what is your email address?
My email address is my first initial, which is L, my last name, which is LYNAH, at, and then Saint ST, James, JAMES, Santee, SANTEE, F as in federal, H as in health, C as in center.com.
That's .com.
Mm-hmm.
All right. Thank you very much. And I'm putting that up there, folks. With Linda Lina at St. James Santee FHC.com. That's LLYNAH at St. James Santee FEHC.com. All right.
No, it's FHC.
Say that again.
Oh, you got it. Okay, you said it different. The other thing that I wanted to
You're welcome, Angela, and thank you for asking the question.
Thank you. Is that if someone is interested in seeing if they can be one of our vendors at our event on the 13th of August, then feel free to email me your information and I will pass it on to our outreach coordinator, who is Ms. Tamika Obing. And then she would reach out to you and let you know, whether you can or cannot and how it will be set up. So once again, that's going to be on August the 13th. It's going to be in Georgetown at the Wynyard Bay Auditorium, and the time is going to be from 10 to 1.
All right. Very good, Linda. As always, it's good to have you on, giving
Thank
us some updates and a quick show today, but that's all right because more people watch those quick shows. But
Right.
next month, we're going to have a little bit more details and special guests joining us.
Mhm.
Couldn't be with us today, but we will have a special guest next month, and we'll really do a deep dive with what's going on with St. James Health and Wellness and public health awareness.
Right.
Linda, thank you very much for joining us.
You're welcome. And then also, Marilyn, this is a holiday weekend, so a lot of people are probably on vacation as well. So we are saying to you to stay safe, enjoy, but do be careful. God bless.
Linda, I'm so glad you remembered that. Thank you very much. I appreciate you reminding everybody that it is Independence Day weekend. Please be safe out there, folks, and watch that drinking and driving. Slow down, be patient, and enjoy the holiday.
Amen.
Thank you, Linda, and we'll see
You're
you
welcome.
later.
Thank you. Take care.
Good night.
Bye, everybody. God bless.